Thank you all. The presentation will be given by the organizers. We discussed that before, so I make a brief introduction before I see slide 1. I think this meeting is a chance for all of us because it's a very small group of global experts, and interconnection can be extremely viable and precious beside the routine meetings which we all know. For sustainability of this meeting, I would just recommend that we have more interactivity, maybe different platforms like the speaker platform, the participants platform, the organizers platform, and such a meeting has to serve all of us. It should not just focus on data collection and profitability. So that's a very brief introduction. Now, is this science, such a title? I don't know. This is up to you to judge. Is it worthwhile that I listen to such a presentation in such a meeting? This is also up to you. I hope that I will have a critical and constructive feedback from all of us. So what I do know is that healthcare is a challenge globally, every country. Exploding costs, the complexity of healthcare without any details, and the unknown role of integration of KI. So what do we need to do? I think very important is patient first. Also health caregivers first, and then the rest. So this grew out of discussions with patients in the oncology setting, and I try to give you a few pictures, moments, and I hope that I will have some feedback on the platforms because without your feedbacks, it's useless. So I would like to thank our patients, the families, the healthcare teams, which I had the privilege to cooperate, or the networks, the international networks. They are all part of this presentation. Next slide, please. So we all are, everybody here is also a patient, and we appreciate remaining human, the empathy of the caregivers, time, which is always critical for conversations, a calming ambience, easy to understand information, not the complexity of 30 pages for a patient-informed consent, swift communication of the results. Every minute counts because I'm waiting if you have cancer or no cancer. The excellence of our healthcare staff, the interdisciplinarity, top infrastructure, and the quality assurance. And it helps if healthcare in your country, the hospital where you provide your healthcare is not in a deep financial crisis, which is rare. Next. So the essentials for a culture of conversation in patient care. Next. And this is just my image. You have yours, and yours might be much better, but I can just tell you what I lived in or what I live in. So we must give the patient a place where they feel well, but they would never be there if they could choose freely in their life. Nobody wants to be sick, nobody wants to be a patient, and still we have to welcome them. Next. Patient information, I think that's the first stuff. Is it a website? Is it an app? Is it something sent at home by mail? Is it the first contact at the administration desk? It needs to be hands-on information. Patients have to feel, to sense what they expect, what they can expect, and what we can provide as healthcare givers. Next. So I try to make an upside-down tree called an picture in words, a conversation tree. The roots, the most important of everything in this patient tree, are the patients, their brain, their heart, their soul. But the same is true for the healthcare staff. They also give their roots every day for every single patient discussion, conversation, for every patient treatment. The tribe might be staying human, being human as a patient. And the same is true for the caregiver. We don't want to be pure administrators driven by business models. Then the branches, this is very fragile already, is giving or undergo the therapy, the cancer therapy. And the ultimate flower is continue to live my life. As a caregiver, not to be exhausted after the first year in my residency, not to be depressed after 30 years, and for the patients, of course, best quality of life. Next. So if this is true, a good conversation can grow also like a patient, like a healthcare giver and this tree. Next. So communication, our needs to the point. for security reasons, for quality assurance, for many restrictions, communication is very complex, exhausting because you don't want to forget something. And there is always an add-on. And what we have to learn, I think, specifically in these times, is facts and to the point. Short, concise, precise, but still with empathy. And if you do that in a well-structured way, I think this is a chance to improve healthcare. Next. Vital ingredients of communications, I think, beside our knowledge and beside our excellence as a healthcare provider, is empathy, creativity, and sensuality. And this is a design by KI because I think for such words, it's always good to have a picture with it because everybody feels different. If you look at this picture, the words are kind of black and white. Next. So I think, at least in, say, large parts of Europe and North America, we have to learn how the other side views what we do. So as caregivers, we have to understand how is business and controlling, how is politics understanding patient care and treatment delivery by healthcare specialists. What we do agree altogether, politicians, business controlling, and healthcare providers, is time, empathy, knowledge transfer for the patient and the relatives is important. Interdisciplinarity of patient care is important, holistic, comprehensive. The positive patient feedback is very important. Certifications and audit probably make things better if they're not a business model on their own. And the cooperation with leading national, international centers is, I think, a win-win for everybody. But what we don't agree is that business is really sharp on, is holistic patient care really profitable? Why should you talk half an hour to a patient about his needs if this is not something which we can bill? The shortage of qualified specialist staff globally is a huge problem. So we have to recruit Gen Z that they think healthcare is something they would like to do something for their life. Lack of organization, this is probably not here to discuss. And another, I think, global problem is we trust technology more than people in many ways for efficiency, data, specifications. And I think this focus has to be carefully seen and rebalanced. Next. So living our strength as humans, as caregivers, as specialists, as researchers, humanity, empathy, time, and knowledge. I think those can be 4 pillars of our patient care. And we all know it's always the first seconds which matters in a contact, in an interpersonal contact. Next. So what we tried in Zurich is that we had a series of lectures, which is now in the 6th year, to look into patient care, cancer care from a different perspective. It's palliative care and it's called The Other View. And we have writers who wrote novels, not scientific writers. We have artists, sculptors, painters who provide a specific side of how they feel about their interaction when they were patients. One of these books from Ustfers was now nominated for the yearly book award in Switzerland, and some of these sculptures are very well known of the lecturers. And it's this interactivity which stimulates students, so they really ask questions which I never heard before in classical seminars about cancer, oncology, care, and therapy. Next. So this is just one example. It's a patient who painted herself during her therapy with a locally advanced breast cancer. And on top left, you see her during anthracycline chemotherapy, and top right, 1 year after completing of the whole therapy without evidence of recurrence of disease. Bottom left was her most critical moment, as she describes to us, when it was not clear with the staging examination, CT, MRI, PET, if she had metastatic disease or not. It was unclear, but finally it was not metastatic disease. This were days between hell and heaven. And she was looking to a watch 24 hours a day when a call came back from the physician declaring her as sick or probably curable. The picture in the middle is exhaustion after completion of the whole treatment, just the next day. And the picture on the right side, on the bottom, is the same when she painted her portrait. So light and freedom and passion for life, 1 year after completion of treatment. Next. So we have to be careful, and we all know this, but it's probably important that we stress this from time to time. Care is not top down because we are such privileged position as a healthcare provider. We are the specialists, we are healthy, we are well connected, we are a natural authority. And the patient, he is seriously ill, he is alone with the disease, and sometimes in oncology, very often in oncology, the fear of death. Thanks for the comment, by the way, which was just highlighted. Thank you very much. Next slide. So I think this is very subjective again. It's also a cultural moment. You will see that in your country, if you look at the global aspect, completely different, and you're right. But say a focus in Switzerland, in Europe could be swift communication of diagnostic result is key. The wait is a burden. Every second counts. And if you have a call at 10 o'clock at night from your physician telling you that you're fine, this is probably the most important, one of the most important moments. Not in life, but for many, many years. Next. And also, don't involve the patient in your daily business, which is hectic, which is up and downs, which is overwhelmed by data and calls and emails and appointments. Try to protect the patient from this. Give her, him, peace and space. Because maybe after 5 minutes, there was nothing to say, she or he suddenly says, I have a problem. And then the discussion starts. And these are the relevant things. It's not only the chemotherapy for tomorrow. Next. So what I tried is, this is now subjective, to kind of summarize these impressions in fictitious, very short stories. And I will guide you now through a few. Don't be afraid, this is not long, but just tell you, we don't have to be exhaustively extensive if we talk about essentials. We can also try to make it as compact as possible and just communicate this. Next. So one of these micro stories, as I call them, was just recently published in a US journal, a scientific journal, Practical Radiation Oncology, which is the official Astro journal. And I read it, but very rapid. It's fictitious. It's children who are playing, and one of these children just lost her mother from cancer. This is real. This is something which I experienced, and the rest is now this fictitious story. So one of the children are playing, little patient on the children's phone. They're sitting next to each other with a plastic phone, and the little patient says, hello, doctor. I would like a white and a black car to visit my mother. And please an umbrella. The other child, little doctor on the children's phone. Hello, we are not a car dealership. We don't sell cars. We are a doctor's office that wants to make sick people healthy and happy. So the other little patient who lost her mother, that's exactly why I'm here. A white car picked up my mom from our apartment last week. She was carried down the stairs in a narrow bed. She waved to me as she left. It was raining outside and I was soaking wet. And yesterday, my mother went to heaven in a black car. That's what my father told to me. But I'm not so sure about this. That's why I want to visit her now and ask when she's coming back home to me. Next. So I just want to say what has been written in an editorial. This micro story had an editorial, which was a surprise, and it's only the last 4 lines. Just be aware. Many people, many politicians who are honest say, if I am to speak for 10 minutes, I require weeks for preparation. If I have to talk 15 minutes, 3 days are enough. If I have to talk half an hour or 2 days, I'm ready right now. So it doesn't mean if you're concise to the point that this is less work for preparation. And it doesn't mean that it creates less attention. Next. So just maybe one pictures again. This was a palliative patient who was just discharged home. She was dying, but she had a chance with ambulative care to go back home for a few days. And her husband was waiting outside the palliative care unit. And on top left, this is in German, I will translate it to you. This is the text. And on the bottom left, you see a picture, which was twinned with this text from a friend of mine. All pictures are from Iceland. It calls the encounter of two humans. 8 steps, 4 eyes, 2 hands, 1 huge hug, and an eternal moment. That's all. So it just tries to say the emotions when the patient leaving palliative care unit for just a few days to go back home and ultimately to die, when she saw and met her husband outside the unit. And I tried to bring that down in a few lines. Next. So the dialogues prior to the night is another way which I try now to write a novel, but I think this is not the focus here now. We go to the next one, please. So the references are listed here for you. Next slide. And now I'm looking forward at least to some chats, inputs or discussions. Next. Thank you very much.